Welcome to Megaphone. I'm Dave Self. Megaphone from Medvalista Media is where we invite healthcare leaders to share their thoughts, insights, perspectives, and the occasional rant, and get their insights to this dynamic world of healthcare. And today we're so privileged to have with us Dr. Jeff Stuart with more than 3 decades of leading and supporting healthcare organizations. He's a graduate of Stanford University, the Wharton School, an anesthesiologist by training, a physician leader by choice, and co-founder of Resolve Conflict, which is an organization focused on navigating conflict and cultivating collaboration in healthcare. He's also a former starting point guard for the Golden State Warriors. Okay, I made that last one up, but it seems to fit with all the amazing things that Dr. Stuart has accomplished. He really is, though, a trained mediator and a newish member of Medvalista. Dr. Stuart, welcome to Megaphone.
Well, thank you very much, Dave, for having me.
Well, before we get into other stuff, inquiring minds want to know, with your many years in the Bay Area, are you indeed a Golden State Warrior fan?
Well, yeah, as a matter of fact, and I had a twinge of pain as you brought that up only because of how the season ended. So, yes, I am a big Warriors fan with my daughters who grew up playing basketball. And yeah, we were hurting as much as Steph Curry's quad was when he tore it earlier in the playoffs.
Yeah, I felt badly for Steph, but hey, they finished ahead of the Kings, so you got that going for you.
Oh, yeah. And, hopefully we got one more year of giving it a go. We'll see what happens.
Excellent. Well, Dr. Stewart, would you share your story of where you're from and the path you've traveled to where you are today?
Sure. Well, I guess I'll sort of fast forward the early part, but I grew up in beautiful Buffalo, New York. So as much as I am a Warriors fan, I just want everybody to know I'm a big Bills fan because it's a big part of my identity. And so I guess resilience is built into me because of that.
Yes, it
And
is.
my family, like many from Buffalo, kind of migrated out west. I ended up going to college. I was very blessed to go to Stanford and be part of that, in a lifetime ago. Stayed in California for my medical training and went to Southern California, trained at, went to medical school at USC and trained at UCLA. Came back to the Bay Area to go into practice as an anesthesiologist. And actually, I'm still practicing a little bit because it's important to me to keep that street cred as we move forward with other things we're trying to do. And in the course of that, it was interesting what you had brought up, physician leader by choice, which is actually, I think it is was my destiny. But I think like many young physicians that end up in these leadership roles, I'm not sure if choice is by my choice is the exact path. And I only bring that up because part of, a lot of what we'll hopefully get into in a little bit is how young physicians, men and women, are thrust into various roles of leadership and administration without any real background or training, which is something we're really trying to address. But in the course of my practice within a few different anesthesia groups and then independently, yeah, leadership roles, I guess, did find me, and I took them on, and everything from being involved with leadership in the inpatient hospital in various ways. It's originally on the medical staff side as chairman of the department, a part of the MEC, the Medical Executive Committee at the hospital for many years. And then subsequently over the next 25 years, took on roles on the administrative side, including about 3 years as a chief medical officer for the hospital around the time of the pandemic, which is sort of towards closer to now in my story. But throughout, I'd had various roles on the medical staff side, as I described, and then also on the administrative side, which, just to explain to some folks, especially in California, the medical staff and administrations are independent. So most times you're going to have a role on one side or the other. I was lucky enough over the years to have roles on both sides, which really has kind of opened my eyes to the issues everybody's facing, beyond what they only feel like they're facing. And
Sure.
then, beyond that, have also been a part of various interdisciplinary and, joint venture situations with a community hospital as a member of a board and things like that. So we came to the pandemic, and that's really where the work on resolved conflict was born, actually.
Okay. So, by the way, I want to pause for just a second.
Yeah.
Your comment about being a young physician and maybe it
Yeah.
wasn't a choice.
Yeah.
That is a theme that we find with so many of our
Yeah.
Medvalista physician leaders when they talk about how they got to where they are. It
Yeah.
wasn't just chance, but they were in a position at the right time. Someone saw potential and said, "Hey, would you?" or "I need you to."
Yeah.
So you follow that theme very well, and so it's
Yeah.
always fascinating to me to see these through lines with
Yeah.
our community, and
Yeah.
that is certainly one that we're finding to be a trend. So
Right.
the territory that you and your partners are willing to explore may be one of the most misunderstood and ignored in all of healthcare. It
Mhm.
feels like that dark secret that the family never wants to discuss, and let alone admit exists.
Right.
Why is it that conflict is the thing that shall not be discussed?
Well, as we've kind of broken this down over the last 5 years, we really kind of have really dug really deeply into conflict in healthcare and why, as you say, Dave, it's really something that has not been discussed, really not really mentioned much in the medical literature till the late end of the last century. And I think it's because it's kind of this kind of conflation of a problem and emotions and things people don't really want to deal with. And nobody wakes up in the morning saying, this is going to be great and we're going to go solve some conflict. Well, except maybe me now. And I think that it's just really difficult to get your arms around something that is such an emotional component and we're not prepared for coming through any with respect to healthcare, any medical training. And we're really kind of focused on the physicians here, especially to start with our work. And I think when you're in an environment with a hospital, especially as healthcare has evolved, as you know, to be more high pressure every single year without even the outside effects of stressors like the pandemic or operational pressures, cost issues, beyond everything else. It's something that conflict. I think people don't realize that it is an inevitable piece of what we do for anybody, let alone in healthcare. And I think it's really interesting that there's a study in 2011, just getting to your back to your question on conflict styles, which there's something called the Thomas Kilmann conflict instrument where we assess people can get their conflict styles assessed. And in healthcare, at least in the context of their work, the majority of healthcare workers are conflict avoidant. And in other populations, a solid, 50% of people are collaborative, which is really where you want to go. And I think there's something about our within the healthcare realm, there's so much tension and pressure to kind of do the next thing that this is something that is, and we're very focused on problem solving, and this is a clinical issue, and we're going to kind of break it down. And that's where all our training has focused. And when
Yes,
something is thrown at us a little bit outside of that realm, we we lose the ability for some reason. I think lack of training, lack of awareness really is my feeling, to be able to kind of attack it in a problem solving way, and we become emotionally overwhelmed. And it's much easier, you really get into the simplest reason. I think it's much easier to avoid conflict than engage it, even though you're sacrificing
absolutely.
potential.
Absolutely. I think most people feel that way in and outside of healthcare. Conflict is rarely something that people seek out, again, to your point, unless it's you and your partners.
Right.
Uh, but it's not a comfortable place to be. And we're not wired to be conflict focused. As you point out, conflict avoidance is the easy button. And it's also interesting that as we have interviewed so many of our physician leader colleagues here in Medvale, their training really takes them from the top of the funnel where what could it be to it's this. And
Hmm.
that scientific approach, that evidence-based thinking, probably does make it pretty difficult to deal with something that can be so emotionally charged, especially if it's a physician and a non-physician in the conflict arena.
Right.
It could really be difficult for a physician leader or an administrator to find that ground of, I think you mentioned collaboration.
Right. No, and I think it is equally as difficult between two physicians sometimes, just to add another category. And I think a lot of what we're trying to do is give uh, physicians, and especially young physicians, we really feel like on the front end of the pipeline of trainees and new physician leaders, give them an awareness and a skill set and a background which will allow them to look at conflict in the same kind of problem solving way that we look at everything else. Because there is evidence out there from the not enough work that's been done in this area in healthcare anyway, that with some training and perspective you can build physicians confidence to deal with these issues. And it's interesting to me because when Paul and I first were putting this together, we were kind of coalesced around conflict and communication about something we felt like at this stage of our career, maybe we could work on to support physicians going forward. That's really our passion is, and our, behind doing this is really trying to provide support for physicians as things get harder and harder. And, this area of conflict and conflict resolution was something that, as we've talked about, was so avoided. And I think it's because nobody really was exposed to it or had skills to deal with it, or even the awareness of why it's is significant as far as building a competent organization. And I think if we can get people to kind of change their attitudes about conflict as opposed to something where your reflex is to avoid it and it's easier to avoid it, if you build some awareness and skills around it, which is our goal, that it is something that becomes a little more interesting to interject into, number one, and number two, can be something you can deal with confidence. And as I've thought about it, conflict is like not every disease or medical condition that we address are we able to 100% cure. But we
Right.
do algorithms and an approach to how we want to do the best we can to give us the best outcome for the patient. And I think, that kind of approach to conflict, having a plan and an understanding of what you might do in a given situation so you can kind of approach it more scientifically, if you will. I think it can make a huge difference. I mean, I've seen it make a difference in my kind of microcosm of experience, and we're really excited to see if it can make a difference throughout.
So if you were king for a day or monarch of the moment or whatever term we're going to use these days, sounds as though you would inject this kind of thinking and training early into the educational arc for physicians.
Yes. No, I think two things. I think that is absolutely correct. I really want to mention there's a woman named Deborah Girardi who was kind of we read some work from her from geez, almost, 2009, so a while ago, which as we were looking into this, and that was kind of what really was kind of a seminal paper for us as far as, our interest in how we could address conflict and the fact that there was a lot of potential. And her approach really kind of dictates a systematic approach to conflict for organizations. I mean, on the individualistic level, yes, as I was describing, but also on the organizational level with having, as opposed to a reactive approach, more of a systematic approach where you'd have a process that you would follow for conflicts of various types. But as we've dug into this ourselves and as we've done some work for organizations, it did become clear to us that beyond getting called when there's kind of a crisis point to help, given we're mediators and facilitators with specific problems that have risen to the boiling point, which is always the most difficult time to deal with it. We
Yes.
were kind of focused on things on the front end anyway, as far as how we could make a difference. And then through our work, we were really surprised about the kind of the hunger for training and background for physicians. And when we did some of these trainings and spoke at a medical staff retreat, we just saw the real interest and engagement of the younger physicians in what we were talking about. And so it's our thinking started that, wow, this is kind of cool that we can affect and these younger physicians before they're at least fully into the fire, with this attitude of conflict being, a problem that we can learn how to solve. And then it took us, the next logical step was, with trainees and looking into it, where there's in graduate medical education, there are some isolated programs with actually that had transient positive results with respect to trainees and training them in difficult communication and conflict, and really just kind of logically putting together, if we can put some of those skills in on the front end with residents and young physicians. And as you know, it's a very hard path being in that position in the first place, and there's a lot of conflict inherent to just their positions. We really felt like maybe this would be as big a bang for the buck as we could get, overall, beyond actually actively solving conflict, is addressing training and support and confidence building for folks on the front end. And again, Paul and I had both leadership positions had found us, and there's a lot of sweat, tears, and stress over the years of every time we were dealing with these conflicts when we were young physician leaders, because in those roles you have to deal with them. And we learned how to deal with them on the job, and I guess we were keeping a mental file of how we've been able to do it. And I think when the pandemic came on us, and we were, I guess, lucky slash unlucky enough to be in the roles we were in at the time, because it was, in some ways counterintuitively fascinating to me to be involved with that, and the working together and the collaboration that arose from that. It was kind of an amazing learning lab as far as the potential for collaboration when people were constructively engaging differences of opinion, which is what we were doing during the pandemic.
Such an important dynamic has to have collateral damage. Can you highlight for us what unaddressed conflict can lead to?
Yeah, so again, conflict avoidance is unfortunately the default for many of us in healthcare, the majority of us, I should say. And when a conflict is not addressed, or the can's kicked down the road with some difficult conversation, it doesn't get easier, it just gets harder. I mean, relationships become damaged because honest communication is sacrificed. You lose opportunities for growth. We really feel like conflict engagement, and we really were first exposed to this with Deborah Girardi's work, the growth of knowledge from candid conversations about things without while being able to manage differences of opinion. The potential for that is great, and then beyond that, the damaged relationships and the lack of creative thinking that comes from just shutting down a conversation because you're avoiding the conflict. And then beyond that, a very I guess obvious example in the medical staff world can be, if you to a doctor who's behaving badly and there's conflict around the hospital, something that's not addressed over months, if not years, and those who have had my roles have seen this many times, that never ends well. And you end up with a judicial review, you end up with lawyers involved, you end up with sometimes hundreds and hundreds of thousands of dollars of costs. So there's a cost, there's a real cost. I mean, there's a human cost and there's a financial cost to avoiding conflict. And I really think the way that we're looking at it, the most interesting thing that I've learned as I've learned more about conflict is this potential for growth and potential for um, unique, creative win-win solutions from everybody having some conflict-related skills. Yeah.
No, I think you covered probably three of the follow-on questions that I may have had in a very nice package there. But I hear you saying that dealing with conflict well can be learned. The earlier we start in a career, the better for especially clinicians and medical
Yes.
professionals. It would be great if that was embedded into the curriculum of what folks have to endure to become a physician or a trained clinician.
Yes.
Um, what are the common causes of conflict that you found? Are you picking up themes of what causes conflict, either between physicians or physicians and administrators? Any
Yeah.
sense of that today?
Yeah, no, absolutely. I mean, there are several. Some key ones are, oh, especially in today's world, whether it be administrator physician or physician efficient physician, is the limited resources, whether it be block time for surgeons, whether it be enough nurses to handle admissions. It's these are things that the resource allocation piece of it is always kind of a hot button issue, but it's more and more. I think organizational priorities of hospitals, differences between administrators and physicians, and physicians really kind of lack of control these days over many situations they're dealing with day to day, I think is something that really is also, quite important in the conflict realm. There's interpersonal conflicts that are inevitable in any workplace situation. And then I think something that's always been there is we're dealing, and I work in an operating room, we're dealing with very tense situations, life and death. And then you put these operational pressures or resource pressures on top of that, and you've just kind of created an incredible recipe for conflict. And beyond that, there's other reasons for conflict that the hierarchy of a hospital, and that's evolving, obviously. Different values where I was cool about being the CMO was getting the perspective. I mean, I knew everybody in the hospital as an anesthesiologist there for years, but really kind of going behind the scenes in that role and be able to listen to nurses and administrators and really, understand their perspective and try to kind of bring that to the medical staff. But you can have a doctor and a nurse who, as far as the values piece of it, who really they both feel like they're sincerely doing the right thing for the patient, but they're coming at it from a little bit of a different angle that maybe the doctor feels like this, procedure X or whatever he's going to do needs to be done right then. The nurse is concerned that the patient's wife doesn't know about it and wants to tell them first. And this is just, things like that where nobody's really wrong and we're all trying to take care of the patient, but we kind of bog down in our roles. And what was interesting, just kind of going back, if you don't mind building on this, is that beyond drawing from these causes of conflict that or drivers of conflict is the term I like to use. In thinking back about the pandemic, we had a common purpose of survival, really. So we were able to kind of coalesce around that common purpose and collaborate. What's interesting to me and interesting, frustrating, is that we've been so distracted, I think, by a lot of the pressures of healthcare, we've forgotten that we ultimately have this common purpose of the patient. And if we can somehow get everybody working as a team around that common purpose of patient care, which I think is something we can appeal to everybody with respect to. I think there's a lot of potential for improvement in the future.
That's an interesting perspective because, again, a theme that we've had with a number of our guests and in my own experience in my day job during the guts of the pandemic, the rhythm was crisis decision action, and that stretched over months into a couple of years. And so that common purpose really took over, and there was less room or less appetite and less energy for worrying about these petty things that can blow up into much bigger things. If I'm deciphering what you're saying well, that really seems to be something that is a common touchstone. Maybe we could bottle that and share it once in a while when we get bogged down in the administrivia.
No, I think, well, that's exactly right. And I'd say even beyond that, this idea that in those conversations around the pandemic, when I'd be in a room with five people trying to put together a testing program. Um, Everybody didn't necessarily agree on exactly how to do this, but there was, again, this common purpose and there was respect for each other's perspective and skill set. And so in those conversations, even though we didn't agree on everything, we were able to kind of talk it out. And, this concept of mining for conflict, sort of a little bit, I think is relevant here, where we would ask everybody if they were okay with this and what was the issue with it. And we came up with much better solutions than if one of us had been conflict avoidant and just deferred to the other, or what often happens even now around those kind of issue, those kind of significant issues, not even necessarily kind of the piddly issues, where people kind of hold their ground and it's kind of like, well, I'm representing this group and we're not really getting to that common purpose. So I think it was really interesting. And what was also disappointing then on the back end was how quickly we seemed to kind of
Of
fall back
course.
into the prior way of doing things.
Now, that lack of self-awareness came back pretty rapidly for
Yeah,
many of us. I look in the mirror when I say that too, by the way, so I'm
yeah,
not
oh,
chucking
yeah.
rocks at anybody. On that point, recently, a friend of mine used a phrase. We were talking about self-awareness in another context, and he said, "It's really hard to read the label from inside the jar."
Mhm.
I've never heard that before, but I told him that I was going to shamelessly steal it. So this is the first time I've used it. But it's true that when we're not in the guts of that crisis, where we're really hearing what others are saying, that it's easy to come back to the I, me, mine. And is that a theme that you find in conflict? It's
Oh,
where people are looking more internal instead of greater good.
absolutely. And it's really this creation of awareness of yourself. It really so in my mediation training, it's interesting, which I didn't anticipate this going in, but a key piece to being a mediator, a facilitator, is really, assessing and being aware of your own emotions and managing them going into a meeting or going into a mediation. And I mean, I know that probably sounds maybe a little obvious to people, but it's not something we reflexly do. It has to be intentional. So you need to kind of know where you're at going in so you can kind of, I'd say, modulate that, if you will. You're not going to get rid of all emotion, but in any kind of situation where you're trying to problem solve, being able to modulate your emotion and be aware of how it may affect what you're saying and doing, I think is exceedingly important. And you can draw people, you can train people out of this I mean mine perspective, even though, as we were talking about a few minutes ago, so much is conspiring to make you think that way, and your background and your coworkers, et cetera, within your tribe, if you will, of doctors, nurses, or administrators. And what's really interesting, like with I found a lot of common ground with Pam Holt, who's also in Medvale, and
Yes.
her company.
She's an OG, man. She's been here a while.
Yeah, so I mean, she was my conduit and my sponsor, so I really have really enjoyed speaking with her. But what's fascinating with her work with empathetics and empathy, and how the science behind how you can teach people can learn to be more empathetic, which I don't think if you did a survey of everybody in the land, they would kind of predict that would be the case. And empathy is a necessary but not necessarily sufficient piece of the conflict puzzle, but it does address this self-awareness and awareness of others. So much I think of when Paul and I, my partner, Dr. Anderson, were breaking down, we were kind of looking at why we were successful in communicating with people. So much of it comes down to being willing to listen, and not just. I mean, when I say listen in quotes, I'm describing it in a way where it is, a true listening, where it's, there are skills involved with how you can really make people feel heard, and these are the things we've learned and would like to share with people. And we realize that when you so many times in our roles outside the pandemic, just doctor issues, people coming into our office, if you can listen well to somebody and make them feel heard, and there's the connection to empathy there, it's a key piece, then you tamp down their emotions just by doing that. And I would find, even if I couldn't, as long as I was honest, I had their trust, and I was able to listen and prove to them that I understood. And listening to understand is a term that's out there and that is consistent with our approach. I found just that exercise had such a calming effect on everybody I spoke with. And that was also, as far as the pandemic, was a really important piece, I think, of what we were doing.
There's studies, I'm sure, I've only seen a few, but studies about the difference between listening and hearing, and what patients really want is
Correct.
for someone to really hear them, hear what they're saying. So what you're touching on is more than just a conflict resolution tactic, especially for our physician friends. And you mentioned Pam Holt. Well, Pam has been a guest on Medvale, on Megaphone, and it was in fact our first Medvale Megaphone live in Columbus. Gosh, last fall, and she is just an amazing human being. If you haven't seen it yet, I encourage you to check it out. She really has a lot of great things to say. Well, Dr. Stewart, before we sign off, first of all, it's been a privilege. Thank you so much. But it's a tradition here that we get a little local flavor from guests, and Maria and I are keeping a travel log. So you've fairly recently, I think you had mentioned, relocated from the Bay Area in California to Music City, to Nashville.
That's true. Yes.
Wow. And that place has not just a lot of great music. We were swapping notes a little earlier before we went live. And for everyone, if you go to Nashville, check out Third Man Records, Jack White's little joint. I can't tell you the address, but I can tell you it's great when you get there. But Dr. Stewart, what in your neck of the woods is the I have to go to this place because what's your favorite go-to in Nashville? And we'd love to know a restaurant recommendation in this as well.
Well, there is food there, but I will stay because it is Music City, stay on the music front. And the coolest place I've been here is a place called the Listening Room. And it's a little bit undercover. Locals definitely know about it, but it's a place where the singer-songwriters, but primarily they're known mostly for their songwriting. These are folks that have written songs, top 10 platinum,
Sure.
singles and albums, and they come and they play some of their newer songs, but they play songs they've written, and they talk about the story behind the song, or getting their song in front of the artist, or working together with the song, working with the artist, I'm sorry, on the song. And it's I've been there a few times now, and when it's kind of our go-to place when somebody visits us, because it's not exactly what you would think. It's not going down to Broadway and seeing like a big loud honky tonk, but it is a really neat thing that I think is a little bit undercover, that I highly recommend for everybody that comes to Nashville.
Love that, the listening room. I'm just in my head imagining Jason Isbell walking in with his guitar, sitting down and plucking something out from his pre-drive-by trucker days.
Yeah, and
And
that happens. That sometimes happens.
wow, okay, count us in. When we're back
Perfect.
in Nashville, you can drive because I'll never find it otherwise.
Perfect.
I'm one of the few people get lost in Nashville in an Uber. So,
Uh,
yeah.
okay. All right.
Well,
Well, thank you very much. Yeah.
we'll give you the last word. What would you like to leave us with today, Dr. Stewart?
Well, just one thing, just briefly to touch upon, that I think all of this is connected to, that we didn't get a chance to talk about in our brief time, was really the connection to wellness and burnout with respect to building conflict skills, and what we really kind of, just a catch-all term of conflict competence, that this ability to engage and deal with conflict in a productive way, in a confident way. And I think there's so much tension and stress in healthcare for physicians, that we talked about this earlier, that there is data out there that shows this ability to kind of build confidence and skills in an area that is something that people tend to avoid and get really emotional about, can have a huge benefit on wellness just by building those skills, and can have a huge effect on teamwork and the ability for everybody to work together, which downstream affects wellness. And I think this is really kind of an untapped way, I believe, of making physicians feel more comfortable in what's inevitably going to be, a high stress situation.
Well, thank you for closing the loop on that, because it is another one of the themes that we've come across in many episodes of Megaphone, the different ways that burnout has manifested itself with our physician leaders, our physicians in the clinical setting, nurses, and all those that support them. So So thank you. We appreciate that greatly. Our guest today has been Dr. Jeff Stuart, member of Medvail and co-founder of Resolve Conflict. Be sure and visit medvail.com for more about Medvail and today's episode. Thanks for joining us today, Dr. Stuart. We appreciate the time. And thanks to all of you for joining us on Megaphone from Medvail Media. I'm Dave Self. Be well.